It might seem like an innocuous question, but for many Australians the answer has changed in recent years. The rise of a new industry has given patients in some parts of Australia new access to after-hours home visits from a doctor. While this has been popular with patients, it also has far-reaching and controversial policy implications, which are costing taxpayers $246 million a year. And if the government takes the advice of a Medicare task force, patients' access to home visits may once more be drastically cut. Wait, did you say home visits? Yep. If I want to see a doctor late at night in Sydney, my GP's practice recommends I dial 13 sick, and if I do, then I can get a bulk billed home visit from a GP on weeknights, weekends and public holidays. Unsurprisingly, these services are in hot demand from patients. The rate of urgent after-hours visits has more than doubled since 2011, climbing from about 700,000 visits a year to nearly 1.8 million visits in 201,516. The latest ABS survey on patient experiences showed that the proportion of people having home visits had more than doubled from 13% in 201,314 to 27% in 201,617. The patients had come from late-night GP clinics and after-hours clinics in hospitals in roughly equal numbers. Because these home visit services bulk bill patients, rising demand has led to higher costs for taxpayers. Spending on urgent after-hours visits cost Medicare $91 million in 2011, but that climbed to $246 million by 201,516. Who's using these services? Not everyone can get to an emergency department or LATI opening GP clinic when they get sick outside of business hours. Medicare data for urgent after-hours visits, where a rebate is paid for a doctor to see a patient at home, it's worth noting this includes nursing homes, shows that children are the main users, although the per capita rates are highest for those aged 75 and over. But half of home visits are to the rest of the population. And who's providing the home visits? To understand who is providing these home visits, it's worth taking a step back and looking at how the government funds GP visits. Here's the basic rundown. The rebate for seeing a GP for up to 20 minutes for a standard consultation is $37. To incentivize GPs to provide after-hours care for patients, Medicare pays higher rebates after hours. Rebates for a visit to an after-hours clinic before 8 a.m. or after 8 p.m., after 1 p.m. on Saturday, and all-day Sunday are $49 and $75 for home visits. For urgent cases, the Medicare rebate is $130, or $153 after 11 p.m. and before 7 a.m. The rates for doctors who are not GPs are a bit lower. These urgent visits could be in the patient's home, a nursing home or in the practice, as long as the doctor has to open it especially for the visit. So what is a hard-working GP to do if they don't want to work around the clock? They can get what's called a medical deputizing service (MDS) to provide after-hours services for their patients. That's the technical name for businesses that employ doctors to see patients in their homes on behalf of general practices. Remember that number 13 sick, it leads patients to the National Home Doctor Service, one of the largest such businesses in Australia. Data from the Health Department shows the number of these businesses quadrupled from 16 in 2006 to 83 in 2014. Are all those home visits really urgent? Only doctors who work after hours doing home visits can bill at the higher urgent rate. This includes doctors who work for MDS services but not those who usually work in an after-hours clinic. But doctors who provide after-hours home visits can also bill the visit at a lower non-urgent rate. Bastian Seidel, the president of the Royal Australian College of General Practitioners, says there is no rational explanation for a sudden increase in urgent medical conditions only in the after-hours period. Dr. Seidel says some doctors are not billing appropriately, and when the health department sent letters to the highest urgent after-hours billers, billing rates dropped 20%. Australian Medical Association Vice President Tony Bastone says patient records coming from after-hours doctors suggest some patients have been seen for conditions that did not need urgent treatment. And the health department said in response to parliamentary questioning that of the 180,000 people who had 3 or more urgent home visits, 10,000 of them had never seen a GP in normal hours at all, suggesting some patients were using after-hours home visits instead of usual GP care. Billing rises when after-hours businesses open. As part of a broader review of Medicare benefits, the government has appointed a task force of about a dozen doctors to look into this cost blowout in urgent billing. The task force says the growth appears to be driven not by greater clinical need for the services but instead coincides with new businesses in the market promoting convenient and free after-hours home visits. An ABC News analysis shows that in the 12 months after MDS services providing home visits opened in regional areas, overall after-hours billing per capita rose by as much as 200%. Medicare data shows that urgent after-hours billing represents about half of all after-hours billing per capita, so it is possible that some of the growth is coming from after-hours clinics, but the data shows that in many of these areas, urgent after-hours home visit billing outstrips the non-urgent billing. For example, After House Call Doctor opened in Bundaberg in April 2015. After-hours billing rates went from $7.52 to $23.04 per capita. And those high billing rates are not because there are lots more babies or old people in Bundaberg. The numbers have been standardized for age. The urgent after-hours per capita billing rate in Bundaberg, at $16.93, is nearly double the national average. The task force report showed that urgent after-hours billing in the ACT went up by 1,000% after an MDS launch in 2014, and by 250% in Launceston in 2016. The task force report noted that doctors and patients reported that some companies providing after-hours services encouraged people to use their after-hours service for convenience and then charged the higher clinically urgent fee for non-urgent matters. It would seem there has been cases where convenience and direct-to-the-community advertising, without that usual linkage back to the GP and fragmented care, has become commonplace and an opportunity to deliver a service model which basically is at odds with the whole practice of primary care, Dr. Bartone said. Do after-hours services take the pressure off hospitals? The National Association for Medical Deputizing Services says that MDSs provide a more efficient alternative to emergency departments, saving the health system a significant amount of money. But the after-hours billing task force said it was not convinced by arguments that the growth in use of urgent after-hours home visits has had a significant impact on hospital emergency department services. An ABC News analysis of the urgent home visit usage per capita compared against out-of-hours emergency department visits shows that spending more money per person on home visits does not always bring down overall hospital visit rates. The chart below shows after-hours billing rates per person. On the left, darker blue means higher billing rates and the number of people from each area going to emergency departments per 1,000. On the right, darker green means higher visit rates. For example, the Playford area in the northern suburbs of Adelaide has the highest home visit billing rate in Australia, at $46.20 per capita, but its after-hours emergency visit rate is still above the Australian average. Spyro Dukakis, the president of the National Association for Medical Deputizing Services (NAMDS), says an NAMDS analysis of just the after-hours emergency department visits showed that GP-like visits had fallen by 0.7% from 201,011 to 201,415, compared with a rise in emergency presentations of 39%. There is simply no credible, unbiased way to argue that after-hours doctors are not taking pressure off emergency departments, given they are virtually the only alternative service for GP-type issues when the GP is closed, he said. An ABC analysis of emergency department visits by time of day shows that the number of GP-like visits to emergency departments after hours have only gone up by about 2% since 201,112 compared to urgent emergency department visits, which have gone up by a quarter. But urgent after-hours home visits by GPs, which were much lower than emergency department visits in 201,112, have increased by 128% since then. Will patients lose access to home visits? The Medicare task force that examined urgent after-hours services has suggested a raft of changes to curb billing. The strongest one is to prevent these medical deputizing services companies like 13 Sick from claiming any urgent after-hours services, but they will still be able to bulk bill patients for non-urgent home visits. That would mean that only GPs operating in daytime hours could treat patients after hours at those high rebates. A spokesperson for Health Minister Greg Hunt said the government was considering the task force's report. In October, the minister also announced an investigation into after-hours services after news reports they were using unqualified doctors to treat patients.